Hiya, everybody. Welcome. Okay, welcome everybody. Welcome, Gospel. Over to you, Gospel.
Scam. Hello, everybody. Welcome to another episode of the Nurses Quiz Night. And I'm not just doing this myself, I'm doing this with my boy. With
So,
my
what are
boy.
you saying? What's your plan?
My boy. I'm doing this with my
Anyway,
boy.
everybody, welcome. I want to let you all know that Gospel celebrated his birthday some few days ago. So please celebrate him as you come in as well. Thank
let's,
you.
let's go straight to business. Don't mind the boy. All right. It's another episode of Nurses Night. For those of us that have been with us, thank you for returning. Thank you for joining us and joining us. Yeah, sorry, I got lost in thought there. But basically, thank you for joining us and thank you for also sharing, liking, and posting to your friends, your colleagues, and everyone. And then welcome to everyone that will be joining us for the first time this evening. By my time, it's 4 minutes past 6 p.m. and so what's the nurses quiz night all about is just basically um we asking a set of questions. Tonight we're going to be asking 25 questions, and then basically we just need the fastest person to answer a question. And so the first person that gets the answer to a particular question goes home with a certain amount of money. So, and that certain amount of money is 2K, right? It's,
Yeah, it's 2000 naira.
yeah, 2000 naira. Yeah. So, you go home, you get to go home with 2000 naira. And then, so how do you do that? You just need to be the first person to comment the answer. So, we're streaming live on YouTube, Facebook, and where else?
I think it's YouTube only for today. Oh. There's no Facebook.
Oh, oh,
Yeah,
okay, okay. So we're streaming basically. Today we're streaming on YouTube alone. So I think it's going to be a lot easier for us since we're just streaming on YouTube today. So the first person that gets the answer and posts the answer on YouTube is the person that goes home with the 2000 naira price. And then you're not just you're not just there's no um was it there's nothing stopping you from answering as many questions as you want to answer. So don't, let's say for example you get the first question that we're asking and then you just decide to say, okay, I've gotten the first question, I've gotten 2000, and then you're going off. No, you can stay and win as much as you can. So it's 25 questions. If you're lucky enough, you can get to the 25 questions and you go home with good amount of money.
you can go on 50,000 naira.
Yeah, 50,000 naira. So, and you know what 50,000 naira is in this economy?
Abi,
It's a lot of money.
you really buy a bag of rice.
You cannot buy a bag of rice. Cannot buy a bag of rice. But all the same, it's still something just for tuning into a quiz night and you're getting that amount of money. It's
Yeah.
something. So I just want us to stay locked in, and if possible, you can like, share, and remind your friends. Yeah,
Don't
we're
be
on the
selfish.
friend. Sorry.
I'm just corroborating what you said. Don't be selfish. Remind your friend.
Yeah. Don't be selfish. Just remind your friends. Share on your different nursing platforms. And again, if you want to support this movement, if you want to
Odogu,
support, if you want to support this movement, you're
there are
very
some people
welcome.
that should not be collecting the money.
I'm telling you, I wanted to say that, so I just said, let me hold myself. But and you know that you're not supposed to be collecting this money. Use your church mind. Let me say, like some set of people. We are all religious people. We are all religious people. So let's support any way we can, and then. But it promises to be exciting. That be like, what is our focus this evening?
So we sent out the advert, the flyers, and everything, and I believe someone must have seen that. And as it is on the description on the YouTube channel, on the YouTube live as well, we are focusing on the care of patients with respiratory illnesses. So questions ranging from asthma to COPD to all of that. That's what we're focusing on for this particular edition, and like we said in one of the previous editions, is deliberate so that you can at least go back home with a body of knowledge saying, I've learned something about caring for people with the various respiratory illnesses. Okay. And the way it runs is simple, like Gospel said. I'm just going to reiterate for those who are just joining us. I'm going to flash a question, and you're expected to provide an answer within the space of 60 seconds. And once 60 seconds is over, the answer shows, and then I drop the question, the answer shows, and we'll go through the comment to see who dropped the first and the most correct answer within the time frame required. All right, the first and the most correct answer is the person that gets the prize. It's just a token of 2,000 naira, but we're just doing our bit to reward excellence and commitment to academic excellence. All right. So do well to like, do well to comment. Every time we have a live, we always improve on our subscriber base. So we want you to help us today again. We want to have at least 10, 15 more people subscribe to this channel. Please do that as we start right away. All right.
All right.
Any other
Thank.
thing that gospel?
No, I think you basically said everything. I'm just seeing a few people here already. I want to say welcome to and would you Oluwatomise. Pardon me if I don't
Our
get it
star
correctly.
girls. One of our star girls.
Pardon me if I don't pronounce your name correctly.
Yes.
I'm not from this part of the world. Yeah.
Ipele o.
So,
What part
so
of the
I
world are you from?
so I can see the nurse influencer,
Yeah.
Ishaku,
Always showing up.
Elizabeth,
Ishaku, welcome.
Justina. Yeah,
Hi,
I can
welcome,
see
Justina.
Esther Fale. Yeah.
Welcome.
So I can see quite a number of people already joining us. So
Yeah.
welcome, welcome, welcome. Thank you for joining us. And don't forget to share so that we can have more people on this live, and then people can also get something for themselves. All
All right.
right.
All right. All right. Yeah, let's go. Let's go. I think it's a good time to start just now.
Yeah.
So, question number one, are you happy for me to proceed, sir?
Yeah, I am.
Okay, so I'm going to show the question again, just to reiterate. I'm going to show the question. This time around, we're not doing a demo because we're already behind schedule with time. So I'm going to show the question. Gospel is going to read it out, and I'm
Yeah.
going to put up the timer in 60 seconds, after which I'm going to drop the time, and the answer will be shown. Once the answer is up, every answer that comes after that is null and void. So, all right, and you just have 60 seconds. So be fast, think fast, and drop your answers fast. Now, here you go. Question number one.
So the first question is, which symptom indicates a severe asthma attack and difficulty in speaking? Which symptom indicates a severe asthma attack and difficulty in speaking? So sorry for those that are joining us the first time, you don't get what's it called now, options, just to give us the answer to the
Mm-hmm,
question.
mm-hmm. So your
And
time
you
is
have
going already.
40 seconds to do that. We've got two answers already.
The first and the most correct answer. The first and the most correct
Yeah.
answer. The first and the most correct answer. Which symptom indicates a severe asthmatic attack coupled with difficulty in speaking? Thank you. Thank you for bringing your answers. I'm happy to see all these answers because it shows that we have a very good question. When the question is good, it means people would have
Yeah.
various various answers. It's not confusing, but it's demanding somewhat intellectually. Okay, that's us done. Sorry, I've looked it again as I always make mistake. I'm sorry. Anyway, that's
Oh,
us done. So the answer, I'm going to flash the answer, and the answer is as simple as this. Dyspnea.
tips, yeah.
Okay, so who got it right?
Yeah, so I think it's just one person. It's Oluwatomise.
Oluwatomisi and Woju. Is that, am I right? Before I
Yeah.
say this, and Woju, yeah. Thank you, Oluwatomisi. Congratulations. She gave us the most correct answer, and the very first person to do that as well. Thank you very much. Our manager has recorded it, so you know how you get your money now. So
Yeah.
thank you to our manager on the behind the scenes,
On the behind the scene.
on the behind the
Kind
scenes,
of English is
at
that.
the back side of the whole stage. Thank you
Behind
very
the
much.
scenes. Thank you.
Thank you. However, English will not fail you.
Mhm. In the
Sorry,
place of
everybody. The answer has been flashed already. So let's go to the next
yeah.
question.
So the next question is what is the common color change observed in severe asthma due to low oxygen levels? The time starts now. So what is a common color change observed in severe asthma due to low oxygen levels? So go and answer already.
So the question is, what is the most common color change? Color change. Color change. Color change, color change. Thank you for those who are giving your answers, but please take note. Color change that you see in people who have this severe asthma, especially due to low oxygen levels. All right, all right, all right, all right. Thank you for all those who are dropping their answers. You are doing well already. You are doing well already. Keep dropping your answers. What is the most common color change observed in severe asthma due to low oxygen levels? When somebody has low oxygen levels, what are you going to see physically, all right, as a nurse? And that will point you to the fact that this is low oxygen. Okay, the time is
Yeah.
up, and here is the answer.
Cyanosis.
The answer is
Cyanosis.
cyanosis. We got an answer, isn't it?
Yeah, we do.
The very first person to
Um,
give us the most correct answer is
so the first person would be and would Awoju as well.
Anwoju Oluwatomisin. Anwoju
Yeah.
Oluwatomisin said bluish, blue, and then she eventually said cyanosis.
Cyanosis.
Bluish discoloration is basically cyanosis. So that is correct. That is correct.
So
The
if
first person
that's
said,
correct, but
sorry?
then okay, are we just giving her because she said blue initially? Cause
Yeah, she said blue. Blue is
yeah, so
cyanosis.
that's
Yeah.
yeah, it is. It's just that I would have thought the answer would be blue, not cyanosis. So
Yeah, and honestly,
yeah,
reading the question over again, and I thought I would have just said blue, but
yeah,
thank God somebody, I mean, people use the actual color, so we are
yeah.
happy to give the that out. All right, thank you everybody, thank you everybody. Let's go, let's go, let's go, let's go.
The
What's the
third
next
question.
question now?
Yeah. Which type of medication is typically administered first during an asthma exacerbation? So your time starts now. I'm just
Why are you
laughing
laughing?
because this is almost almost what I do almost every now and then. So I'm
Okay,
just
my chest, my chest, my chest.
my chest.
And then you have to do something. Okay, let's see.
Yeah,
Let's hope somebody gets it once and for all. Now this is a tricky one. Hopefully, we'll be able to find an answer to this tricky one, because I'm seeing the answer and I'm wondering who will we give this one to? Who are we giving this one to?
hmm,
Hmm. 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 Good, 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 good. Keep it coming, keep it coming. Good of you girls, good of you girls. Appears that we have a lot of ladies on this. Oh, nice. We have some nice comments coming in already.
good
Beautiful,
family.
beautiful. Well done, well done. What type of medication will you typically administer to somebody during the event of an asthma exacerbation? All right, person who's got a background asthma, and here you go again with another exacerbation of it. What would you
Yeah.
administer? Time is up, and here is the answer.
Bronchodilators. So
Okay, so the first person to mention bronchodilator is what?
I think it's Ishaku.
Ishaku. Congratulations, Ishaku. Somebody mentioned something that looked. So first of all, let me just use it to process. So the nurse influencer nebulizers is not the answer because you can nebulize saline as well. Because I don't know if you have
Yeah,
experienced that before. Yeah. So we
yeah,
nebulize saline as well. It doesn't have to be a bronchodilator, right? You can nebulize the normal saline that we use. All right,
yeah,
and then epinephrine is not salbutamol. Someone says salbutamol. Salbutamol is just one of the many bronchodilators you can administer, right? So
really.
the most correct answer, remember, we always say the rule is the most correct answer. The first person to give us the most correct answer, and that is Ishaku Bukata. Bukata Ishaku Mensemka. I wanted to complete
Stop
that.
making me laugh.
Thank you,
Oh my god.
Ishaku. All right, thank you, Ishaku. Let's go to the next
Congratulations,
question.
Ishaku.
Yeah, yeah.
All
Ishaku is our
right.
guy. Oh. He's been doing well. Next
Yeah.
question.
What should be monitored first during where am I seeing episode? What should be monitored first during an asthma exacerbation? Your time starts now.
What do you want to monitor first as a nurse? As a nurse, as a nurse. What do you think is the most important um, element of your vital sign? Oh, why am I saying vital signs? That you want to monitor? Anyway, just give it up. Give it. Let me see. Let me see. Let me see. Let me see. I know this one will confuse a little bit. I just hope that we can reach a good conclusion before time is up. Before we waste too much time on it. All right, let's go. Let's go. Keep it coming. What do you want to monitor first during an asthma exacerbation? What do you monitor first? What do you monitor first? All right, that's us done. That's us done.
Time up.
And this is the answer. You want to measure the respiratory rate
Respiratory
first
rate.
of all. All right, and I think the first person to give us the answer is
I don't think anyone gave us the answer.
um. Funny enough, nobody actually said the rate. So the first person said, let me flash it for this purpose. The first person said oxygen saturation is a good one, but
Yeah.
in this case, it's not the first thing you want to look at. The airway, pulse rate, breathing. Now this is quite close. Breathing is, you know what I mean, gospel. It's a broad
Yeah.
term now. So we are still on that. That's still the closest. Heart sounds, no. Breathing pattern. This is even more specific, but it's still not. Breathing pattern you're looking at, is it seesaw breathing? Is it all the.
Yeah.
It's not rate. There's a difference between the pattern and the rate. Gospel, what are you thinking? What are you thinking? What are you thinking?
Yeah.
Anyway,
It's quite different. Breathing pattern could be a lot of other things.
a lot of other
But
things.
the answer is the respiratory rate, right?
It's the basic thing we are looking out for. If it's more than 20, so is it 28 or 30, then you want to start now considering checking the SpO2 as well to
Yeah.
see, okay, and then you now start thinking of intervening in that regard. All right, so who is closest? Who is closest? Who is closest?
No, no,
Who is
no,
closest? The
but
person that said breathing is the closest, at least the first and the nearest to that is the breathing. The person who said breathing. Where are we? Elizabeth.
it's a bit bad.
That's the closest. But honestly, we are not supposed to give you all the price.
Yeah.
This is our own way of saying we are the judge of this matter. Gospel, we are the judge. So what how much do you want to give for this?
Hmm.
Because you did not say the rate. The rate is the most important thing there. The rate is the most important thing. The rate is the most important thing, right? Respiratory rate. I'm just thinking we should just even say nobody got it.
No,
Nobody,
yeah, yeah, that's what I thought as well.
nobody
Because
got it. Nobody got it.
breathing is a lot.
Is
a
it all
wider
wrong?
terminology. Yeah.
All right. Anyway, so that's it. That question, nobody got it. We'll move on to the next question. Thank you, everybody, for your comments, and I'm so proud of you all. Well done, well done, well done. Next question. Showing.
What is the most common position to help an asthma patient maximize lung expansion? Your time starts now. A common position to help an asthma patient maximize lung expansion.
Okay, okay, okay. Let's get your feedback quickly. Don't forget the first and the most common,
Mm.
sorry, the first and the most correct answer wins the prize. The first and the most correct answer wins the prize. The first and the most correct answer wins the prize. The first and the most correct answer wins the prize. The first and the most correct answer wins the prize. All right. And then, and just pay attention to the keywords here. Pay attention to the scenario it's painting. Pay attention to some of the nuances. Pay attention to the unspoken things in this question. You know, it says, "What is the most common position to help an asthma patient?" Okay, so
Mhm.
we've got the answer showing just now. The answer is an upright position. Okay,
Yeah,
good. So we've got some people who gave us an upright position as the answer. Who is that person?
I
The
think the
first one
first
said
person is Victoria John.
Victoria John. Congratulations, Victoria John. You just got yourself a token of 2,000 naira. Well done, well done, well done. Yes, so just to say something about this, I know some people will question that, oh, if they taught us that Fowler position, high Fowler position, that's in
Yeah,
it where you are on the word, you have a bed you can manipulate. But the most common, readily available position you want to help them to is to be able to take in a lot of air and to allow for lung expansion. If they are lying down, get them to sit. If they are sitting and they are not still able to get enough air, get them to stand up, take them to a fresh open space, and then they get a lot of fresh air. Anyways, um, you are free to counter this with a lot of proofs.
mhm.
Just at the end of everything, send a DM and we are going to have a long chat. I remember Ishaku Bukata had one like that with us for one bonds question like that we did some months ago, and then he
Yeah.
was able to his point, and he got his money, right? So so if you have a proof that this question with the context that we have put it is not supposed to be upright, then you can argue it. But at the moment, we are standing with upright. All right, thank you very much, everybody. On to the next question. Question number 6.
All right. What immediate sign would indicate that a patient's asthma attack is worsening? Your time starts now.
What immediate time would you see to think to make you feel like, oh, something is going wrong, it's getting worse, 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 it's getting worse. Very good, very good. Keep it coming, guys. Keep it coming, guys. Keep it coming, guys. Keep it coming, guys. The first and the most correct answer gets the prize. The first and the most correct answer gets the prize. First and the most correct answer gets the prize. The first and the most correct answer gets the prize. The first and the most correct answer gets the prize. So somebody is having an asthmatic attack, but you are thinking it's really, really getting worse. It's really, really getting worse. What would you see? What would you see that makes it different from every other thing? It's unique, but it's very clear that this is something really, really bad. This is something really, really bad. All right, just put it in the comment section. Put it in the comment section, and that's us done. The time is up, and the answer is showing just now.
Wheezing.
So the answer is wheezing. Did anybody get it? Gospel. See your friend too.
Yeah. What?
Somebody put like 4 different answers. Not influencer. She put like 4 different answers. She's the same person that and she actually got it right as wheezing, but had said something else before now, but it's okay. It's okay. So you see, I, I want to resist the urge to shalaye.
You
I want to resist the urge to shalaye.
are
I
permitted,
honestly,
shall I?
hmm?
I say you're permitted.
No, just saying that because we are saying it is worsening. So the
Yeah,
person could have been experiencing breathlessness. You might be wondering what exactly is going on. You might be experiencing shortness of breath, breathlessness, like you said. Person have been coughing, but when you start hearing wheezing sounds, you know this is because what basically causes that wheezing is the narrowing of the
no, yeah,
air of the airway. So,
yeah.
so that's
And
the
just
real thing.
yeah,
Go on,
just to
Gospel.
add
You're saying something.
again, yeah, just to add again, I think most of the times one thing that would be common to asthmatic patients is coughing. So
Mm-hmm,
it's just to somehow rule out that coughing that
mm-hmm, mm-hmm.
most of the times it's something that is always
The
common with
experience. Mm.
asthmatic patients. It's more of like almost anything can trigger coughing for
Coughing,
asthmatic
right?
patients. So
But with coughing, it can easily subside because
yeah,
if you just
yeah,
get out of that area where the trigger is. But you see, when it's becoming wheezing, you need to
yeah.
really
The
intervene.
wheezing sound.
It's showing that it's worsening already.
Yeah,
All right, so we go on to the next question, guys. Thank you. Who got that? I think we are giving it to the nurse influencer. She gave us the
yeah.
most correct answer.
After dabbling and
After that, we're moving left and right, anyways. But
she
yeah,
finally
we
gave
go
us
by the rules. We play by the rules. We are
yeah.
not going to. We're not going to tell you to take us to court here. We go by the rules. We play by the rules, guys. Okay, next question showing just now.
All right, it says what breathing technique might a nurse teach to help a patient manage mild asthma symptoms? The time starts now.
The time starts already. We are trying to meet up with our 25 question goal. So
Yeah,
we'll be a little bit faster. So just indulge us. However, the question is up just now. Question seven now. Question seven. Mm-hmm. Keep it coming, guys. Keep it coming. You can drop your comments multiple times. Remember, we are not against that. The rule is the first and the most correct answer. So if you are the one to drop the most correct answer first, then you win the prize. The most correct answer first. The first person to drop the most correct answer wins the prize. The first person to drop the most correct answer wins the prize. What breathing technique would you need to teach a nurse? Oh, sorry. Would you, as a nurse, teach a patient to manage just mild asthma symptoms? We talked about the other time severe asthma where we see wheezing, but this time around mild asthma. What would you need to teach the patient? Your time is all up. Thank you, guys. Thank you, guys. All right.
yeah.
And then we go to the answer. The answer is post lip. Post. It reminds me of. Let me not talk. Oh my
Oh,
god. Oh my
okay.
god. So that's it. I think the first person to give us a comment got it right. The first person to give us a comment got it right.
It's Deborah
Oh,
Adeyemo.
oh god. Adeyemo Deborah, first lip breathing. Good. So
Yeah,
and would you nearly got it, but the most correct answer here is the first lip
nearly.
breathing, which is Deborah Adeyemo. Thank you very much, Deborah Adeyemo, for joining us and for putting in that answer. Congratulations, you just
Yeah.
won yourself a token of 2,000 naira. Well done to all of that guys who have contributed, and we celebrate you. Next question number 8.
So, what type of inhaler is commonly used for long-term control of asthma symptoms? What type of inhaler is commonly used for long-term control of asthma symptoms?
What type of inhaler would you use for the long-term control of asthma symptoms, guys? What type? What type? What type? Or basically talking about the pay attention to the long term, the kind of medication that will be in it in this time. You know, so pay attention to that. Pay attention to that. Pay attention to that. What kind of inhaler would you use? Um, Good. Pay attention to that. Pay attention to the long term. So remember the long term management of asthma, and that's what we are trying to test here. All right. Pay attention to that. Pay attention to that. It's just 10 seconds to go. 9, 6, 8, 7, 6, 5, 4, 3, 2,
Three, two, one, action.
and that's us done. That's us done. That's us done. That's us done. Answer is
All right.
steroids. Who gave us steroids first off? Who gave us steroids first? Who gave us steroids first? Somebody gave us
Um,
something like corticosteroid first. Salbutamol is good, but
yeah,
salbutamol is a bronchodilator is for the instant when there is an attack. All right, but you see
yeah,
your corticosteroid is for long term management. Okay, you can always check that up and
yeah, true.
argue argue with us or
Mm-hmm.
challenge us. But who gave
Yeah,
us?
even they're even most of them are even placed on the long term steroids. Like you
Mhm,
just take long term steroids like prednisolone,
mhm,
and
mhm.
they are just on it.
So the inhalers are usually steroid based inhalers. Okay, so who gave us the most correct answer first? I think the person is the nurse influencer I'm seeing, isn't it?
Yeah, definitely the nurse influencer.
The nurse influencer, congratulations again. You just won yourself a token. Tonight is your night. Tonight is your night. Well done. Tonight is night. Well done, nurse influencer. You have just won yourself a token of 2,000 naira for giving us that correct answer. And when we go to the next question, question number 9.
All right. It says during an asthma exacerbation, a patient becomes cyanotic. What vital signs should the nurse reassess immediately?
So
What
you said
vital signs should the nurse
should the
reassess
nurse
immediately when
reassess everything? Mm-hmm.
he notices cyanosis?
Cyanosis. If you can link it back to one of the questions we had before, you'll be able to appreciate this now. You
Yeah.
appreciate this now. So you appreciate this one now. So connect it. This time around, patient is cyanotic. You need to reassess something. All right. So give it up. Give it to us. Give it to us. We are here. We are here. Don't hide what you know. Don't guess it. Don't double guess yourself. Don't assume you'll be wrong. Just put it there. Put it there in the comment section. Well done. Well done. Well done. Well done. Well done. Well done. We've got 15 more seconds. 14, 13, 12, 11, 10. And it's almost time. It's almost time. It's almost time. Put in your answers.
All right.
Very good. So here we go. The answer is just oxygen
Oxygen.
saturation.
Yeah.
Oxygen saturation. So I think we have somebody who gave us that first off. So if you put
Um,
SpO2 or oxygen saturation, you are correct. But let's see who gave us
first
that first.
person is Anwoju.
Anwoju Oluwatomisin. Congratulations, Anwoju Oluwatomisin. She drops
Yeah.
the correct answer, oxygen saturation first. Thank you very much. Thank you very much. Thank you very much for joining us. All right, we'll go to the next question right about now. Question number 10.
It says a nurse assesses a patient with asthma who has been laughing and subsequently developed shortness of breath. What might have triggered the symptoms? Your time starts now.
So we are looking at the triggers here. What could have triggered it? What could have triggered it? It's a very tricky one. So you have to pay attention to the question and just read it through and through. The answer is in the question, but you may not know. So just pay attention, pay attention, pay attention. What could have triggered it? What could have triggered it? All right, what could have triggered it? What could have triggered it? Okay, that's good. That's good. Keep it coming, guys. Keep it coming, guys. I'm seeing your answers. I'm seeing your answers. Well done. Keep it coming, guys. Keep it coming. Keep it coming. Keep it coming. All right, keep it coming, guys. Keep it coming. What could have triggered the the asthmatic attack? What could have triggered that symptom of an attack in a patient who has just been laughing and then subsequently, the patient is fine laughing, you've been laughing hard, and then suddenly you just started having shortness of breath. What could have led to that? Well, that's the time up, and I'm just going to flash the answer just now. The answer is this.
Emotion damage.
So the answer is emotions. The emotions. My God, Ishaku. How? My God, he did it. Oh God, Rebecca. I'm so proud of you guys. You got it exactly. But first person to give us emotions is Rebecca. I know Rebecca. I know.
Yeah,
Well done. Well done. Well done, Rebecca. Well done, Rebecca. You've done very well. Ishaku, I celebrate you as well. You picked that. Well done. But unfortunately, this time around, Rebecca I know gave us the most correct answer first, and she's going home with a token of 2,000 naira. All right, for that. Okay, so yeah, emotions can actually trigger it. You can read it up. You can read it up how emotions in quote laughter can actually lead to in somebody who has asthma already, you
yeah.
can actually have that kind of symptoms we just described. Okay, so that's question number 10 gone. Number 11 now. Here we go.
All right. A patient with asthma presents with sudden wheezing and shortness of breath. They mention taking a new OTC medication for joint pain. What medication might be causing their asthma?
OTC
Time
is
start
over the
now.
counter. OTC is over the
Yeah.
counter just to make it easy for somebody, right? So, but in this case now, what particular medication, what particular group of medication will be causing their asthma? So it's basically saying what kind of what group of medications can
Cause
exacerbate,
flare up.
flare up or trigger or exacerbate, asthmatic attack, all of that. So so let's see who is getting it. Let's see who is giving us an answer. Let's see who is giving us an answer. Oh, good, 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 good. We are having some nice answers and responses from our friends here. Very good, guys. Very good, guys. Very, very good. Very good, very good, very good, very good. Nice one, nice one. You guys are doing very well. Keep it coming. You still have 15 more seconds, 12 more seconds now. 11, 10, 9, 8, 7, 6, 5, and it's
Five,
going down.
4, 3, 2, 1. Action.
Action, and that's us done. And the answer is NSAIDs. Somebody gave us NSAIDs, and that's brilliant.
Yeah, that's the list.
Who gave us first?
No, I think it's Rebecca. I know.
Yeah, Rebecca I know did first. Yeah, Rebecca I know did first. She gave us NSAIDs first, and that's congratulations to you, Rebecca. I know once again you just won yourself a token of 2,000 naira for that beautiful, beautiful answer you've given us. She gave us the correct answer, and she gave us the she was the first person to give us the most correct answer. Anyway, so let's move on to the next question, guys. Let's move on to the next question. Number
So a
12.
patient with asthma is using neck and chest muscles to breathe with visible retractions. What does this observation indicate? The time starts now.
What does it indicate? You've seen all of these signs. What does it indicate? What does it indicate? What does it indicate? Fastest fingers, fastest fingers, fastest thinkers, fastest thinkers, fastest thinkers. Keep it coming, guys. Keep it coming, guys. Don't relax now. Don't relax. Don't go away now. Don't go away. Don't go away. Don't go away. What does that observation indicate? What does it indicate? What does that observation indicate? I mean, when you see all of that, what does it mean? What does it mean? What does it mean? What does it mean? When you see all of that signs, what does it mean? What does it mean when you see all that signs? Breathing with the chest, the neck. What does that mean? What does that mean? What does that mean? What does that mean? Thank you, thank you. I'm seeing some good answers now. Well done, well done, well done. Keep it coming. You've got 9 seconds, 8 seconds, 7 seconds, 6 seconds, 5 seconds, 4, 3, 2, 1,
One.
and
Action.
that's us done. So here is the answer. Here is the answer. Here is the answer. Here's the answer. Severe respiratory distress. Yeah. Gospel. I think nobody actually. I'm not sure I saw anybody
No one
put.
got it.
Really?
Yeah,
My God.
Deborah.
I was even going to say we should allow people that said dyspnea or difficulty with breathing, but this is really nice. So you gave us the actual answer, and that's very good. That's who Deborah Adeyemo. She appears to be like a
Yes,
newcomer. Are
yes,
you
she
new?
is.
Let's know if you are new.
First timers in the
Let's
house.
let's give you a first timer welcome. Let's give you a first timer welcome. And you're coming in and then you've been doing well. Very good, very good, very good. Well done. That's it. That's it. That's question number 12 done. And Deborah
Yeah.
Adeyemo got the prize. She got that Answer correct.
Yeah.
Number 13 now.
So the 13th question is, a patient with COPD mentions that they've been unable to sleep well due to shortness of breath with symptoms.
What
Sorry, what
symptoms?
symptoms is the patient experiencing? I was stuttering there.
What did he say?
I was stuttering.
No, I. What are they experiencing? So I just had to put the time
Yeah.
up because we'll be giving them too much time.
Yeah.
Already, we are doing more than 60 seconds technically because the time you used to read the question plus so that's another few seconds added to it. So just so anyways, yeah, let's focus. Let's focus. If you are
We've
there,
got
put the
some
answer
answers
in. Put the
already as
answer in.
well.
Put the answer in. Put the answer in. Put the answer in. All right, all right. The first person to give us the most correct answer. I know it's a bit tricky. I removed the keyword there that could have given people, that could have given you guys a better clue. So I just want to see if anybody will get it without that keyword. So this is the answer, guys. This is the answer. This is the answer. Nocturnal deep snare.
Yeah.
So I removed night, sleeping at night. Oh my God!
Mm-hmm.
Somebody put it. Somebody put it. Somebody put it. Paroxysmal nocturnal dyspnea, and that's even more clear. Um,
Yeah.
so that's it. So because they could not sleep, I just wanted you guys to appreciate the fact that it could be the person could not sleep at night. So that's nocturnal. If I had said night, somebody would have immediately linked it. That's nocturnal dyspnea. So guys, who got it right? I think gospel who got it right. Be my second highest, please, because I'm not sure. I think
Yeah. I think it's Anwoju
and would you
Oluwatomisi.
Oluwatomisin. Congratulations, and would you Oluwatomisin. It appears that some people have just known the way we ask our questions. They already know what because some people are just constantly getting the answers. Well, I'm proud of you guys. Well
Yeah.
done. Well done. Let's give room for other people to as well get more answers so that we'll distribute it. Let's be loving people. We are children of God. All right. All right. Next question showing just now.
A patient with COPD reports a worsening. Rep, a patient with COPD reports worsening of symptoms after starting a new job at a factory. What might be exacerbating the patient's condition?
The time I've started already. What could be exacerbating the patient condition? What could it be? What could it be? What could it be? What could it be? Oh my God. Oh my God. Oh my God. This is amazing. Well done, guys. Well done, guys. Keep it coming, guys. Keep it coming. Keep it coming. I'm so proud of you guys. Wow. Wow. See beautiful answers in the comment section. Wow. That's so nice. Well done, guys. Well done. Keep it coming. Keep it coming. Keep it coming. What could be the thing exacerbating the symptoms of this man? He's been he's been he's been having exacerbated symptoms or aggravated symptoms since he started a new job. Since he started a new job, what could it be that is exacerbating? The answer is showing in the next four, three, two,
Two.
1, 0. Sure. Until this is the answer. This is the answer. We got an answer already anyway. So I saw somebody put
Yeah.
up. So who got it right, please? Okay, so Anwoju
Someone
said
put up pollutants.
yeah, pollutant, yes, and that's correct.
Yeah.
That's correct. 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 All right, let's go. Elizabeth asked that the first and the most correct answer is pollutant. Sorry, what am I saying? What's the name of this person? Elizabeth. Elizabeth, congratulations. You've got yourself a token, a we change, because I know it's nothing to you. I know it's nothing to somebody like Elizabeth, but yeah. Anyways, that's it. So guys, that's the answer. We're going on to the next question right about now. The next question showing just now.
All right,
Gospel.
a 60-year-old patient with a history of stroke and dysphagia. What kind of pneumonia is the patient prone
Okay, this time around we are moving. We've left asthma. We've left asthma, guys. So stop thinking about asthma now.
to?
We've left asthma. So think about other respiratory disorders. This time around, pneumonia. You probably have an idea of the types of pneumonia we have. So I'm giving you a clue already. What kind of pneumonia is somebody with a dysphagia and a stroke prone to? A dysphagia and a stroke. A dysphagia and a stroke. Oh my God, nurse influencer, you're doing well. You're doing well. You're doing well. Well done, well done, well done, well done, guys. You do well. You do well. It is brilliant, brilliant, guys. Brilliant, 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 brilliant. We're almost there. We're almost there. We're almost there. Oh my god. Oh my god. Uh-huh. You know why I'm so confident? I know one person will always get it right, even if
Yeah.
no matter how tricky it is, somebody will always. That shows that you guys are so brilliant. Nurses are brilliant. Well done. Well done. Well, this is the answer, and I'm just going to show the answer right about now. Aspiration. Obviously, because the man cannot swallow properly, dysphagia
Yeah,
is
that, I just saw the top man.
so the next thing is for a person to have aspiration pneumonia. You know
Yeah.
what I mean? So the person that gave us the right answer is who?
I'm not sure anybody got the answer because by the time you said the answer, that was when the answer that came 649. That was just when you were saying the answer, that was when the answer was dropping from that person.
Wow. Well,
So
honestly, gospel. By the time I was saying that, that time I was saying somebody will get the answer, even if it seems very
yeah.
tricky. That was the time I saw Justina's answer. That
Oh,
was the last
did
time I
you?
saw her answer. So maybe some network glitch made it a little bit delayed from your hand or whatever.
Oh.
You live in downtown. You live
Ah,
downtown.
it's all right.
I paid back my dues. You know what I mean? You've done it
It's
for me
all
well.
right. It's all right.
Anyway, we are giving it to Justina Ekudayo because I believe that by my own judgment, I saw your answer at the right time, just before I flashed the answer. Right. Um, oh, good. Thank you. So we have a second witness here, gospel. Kenny has just told me that yeah, Justina dropped it before me.
Fair enough.
Fair enough.
Fair
Fair
enough.
enough. Justina, bind all the enemies against you of winning a prize. Anyway,
Hmm.
that's it. That's it. Thank you, guys. Justina, you got it, and that's a token of 2,000 naira to your pocket. Well done, guys. Let's go on to the next question.
All right. The
Gospel,
next
the long one.
question is: a patient with pneumonia is exhibiting signs of increased work of breathing and is using accessory muscles and increased respiratory rate. What position should the nurse place the patient in?
Okay, guys, your time start now. It's just a distraction. Don't be distracted with your plenty English. Just
Yeah.
focus. So this time around, there's a tweak here. So pay attention to the scenario this is painting. This case is bringing to you. So patient has got pneumonia, exhibiting signs of increased work of breathing. That's difficult breathing. It's not using accessory muscles. It's now having increased respiratory rate. So you are now to place the patient in a position. All right. What position would you place the patient? Okay. Okay, so let's go. Oh my God, I've got a lot of answers coming in already. A lot of answers coming in already. A lot of answers coming in already. Just pay attention to the tweak in the scenario. I know it might be a little confusing, and I'm sorry for that, but yeah. So
All right.
the
Yes,
answer
Paula.
is Fowler's position. This time around is Fowler's position because we are trying to depict a scenario where the patient is unable to, get out of bed. Is
Yeah.
now laid down, so you need to help the patient to a Fowler's position. And the first person to give us the most correct answer. In fact, I love the fact that this person said I Fowler's position, which is nice. Which is nice. It's a little higher than Fowler's. I'm not sure. Is it 60 degrees or so? But yeah, it's okay. It's okay. It's okay. It's okay. So the first person to give us the most correct answer, I
Star
think.
girl.
So the Star Queen, where have you been? Star Girl. Star Girl, where have you been? Well done. Congratulations. 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 Congratulations, Star Queen. And that's you winning yourself a token of 2,000 naira for answering that question correctly. All right, now let's go on to the next question, guys. Next question, guys, showing just now. Question number 17.
All right. A nurse is monitoring a patient with pneumonia who is receiving IV antibiotics. The patient reports itching and rash begins to develop. What's the nurse's next immediate action?
What do you do next? What do you do next? Do you want to go and call the family? Okay, you want to go and call the family, or you want to go and call the prayer warriors? You want to go and you want to call the chaplain? You want to oh my god! Or you want to
You
go
call the
and look
doctor.
you want to go and look for the charge, sorry, the head
Doctor.
nurse or the charge nurse or the doctor. What will you do first? What will you do first? What will you do first? This is a very simple one, I believe. Everybody should get this one correctly. But the first person to
You
give
want
us
to
the
go
most
and call DDN.
we want to go and call the DN. Oh my god. You want to go and call the DN? Or you want to go and call CNO?
Hmm.
Let's see. What will you do immediately? Immediately you notice this.
Yeah, no,
Immediately
my patient yìí.
patient you only rush Lara. Oh god, thank you guys. That's it all done. So the answer is as simple as you all have guessed and suggested. The answer is just to stop the infusion. Yeah, stop the infusion first before you think of giving anything. Stop the infusion first. Stop the infusion first. Stop the infusion first. Stop the infusion first.
What is
All right.
lateral decubitus? I'm just
Uh, uh,
wondering.
no, where is that? Where is that coming from? Oh my god.
No,
Maybe that's for the previous questions that
it cannot be.
it might
All
not be.
right,
It might not
probably that's yeah. I'm
be.
just
Anyway,
going
so
to.
who gave us the most correct answer for this
And
question?
would you?
How
No,
would
it's the
you
star queen. She said, "Stop the med."
wait to? Oh, it's true. Oh, I was going to start celebrating and would you? Well, start
Enemies.
with. Oh my, I'm not against anybody. I'm for all of you. I'm for all of you guys. I'm for all of you. Let me not see what I wanted to say.
Is the
He
star queen. The star queen. She's the
That queen,
star queen.
congratulations, congratulations. Stop the media infusing.
What is
Stop.
star? The star queen is a man.
Gospel, you are such. Come on, get out of here. Get out of here. Anyway, whatever you choose to identify with, we identify you that way. but here we choose to call you a man, a woman. We choose to call you a woman.
Apologies. You have to be inclusive.
We are inclusive. We are inclusive. Yes, we are inclusive. Inclusive environment. Well, no, inclusion. Inclusion.
Inclusivity and equity.
Come on, guys. Next question. Next question. Don't mind us. We're just trying to make it fun as much as possible, so you don't have all tensioned up. Okay, all tensioned up. Here you go. The next question showing just now.
A patient with pneumonia is having difficulty clearing secretions despite deep breathing and coughing exercises. What nursing intervention should be implemented?
Okay, and your time starts now. So you've done a few things. This time around, you are not seeing. Um, 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 oh my God, I'm not talking again. Somebody have even. Some people have even started giving me. Oh, what a wonder! What a wonder! What a wonder! What a wonder! We are doing well today, with gospel. We are already in question
Yeah,
18. I wish,
yeah.
because we have not finished that thing. Shit.
Hmm?
I've still not been able to finish. So we are gonna have like two
Oh, that's bad.
some minutes of break, and then I'll go extract the rest. I'll go extract the rest.
All righty.
But we'll get to number 20 first. We'll get to number 20 first. We have it up to 20. All right.
Oh, that's
Keep it
fine.
coming, guys. Keep it coming, guys. What would you do in this situation where you've tried deep breathing exercises, you've tried coughing exercises, and the person is still, struggling to breathe? What would you do? What would you do? All right, guys. And there is the answer. The answer is just go ahead and suction, suction,
Function.
suction. Take away the stuff, the phlegm or whatever is stopping, blocking the airway. Take it away. Take it away.
Oh,
Okay. So
sorry.
who got?
Is this patient? Sorry, can we see the question again? So I just wanted to basically
Okay,
that's
sir.
the question
Okay,
you wanted
sir.
the
Okay,
question
boss.
again.
Okay, boss. Critical care boss.
Difficulty secreting, clearing secretion despite the breathing exercises. Okay. Yeah, that's fine. Functioning, yeah. So
Yeah,
it
this
just
having
it
the.
just took my mind back to a patient I had recently. So I'll just
Hmm.
yeah. So
You know, the honest truth is, while we have some good nursing interventions,
yeah,
many times our nursing interventions may not always yield the fastest results we want. And because
yeah,
for a situation like airway is critical. Oxygen supply cut short to the brain in less than 5 seconds, causes hypoxia, brain death and
yeah,
all of that. So you don't want to wait to start experimenting too many things. You don't coughing, you don't deep breathing. The person is not. Please get the stuff out of the airway and make this patient better. Okay. So the
yeah.
answer again is functioning, and
The first person is
first person to give us the answer is who?
Rebecca.
Oh, Rebecca, congratulations, Rebecca. Rebecca, congratulations. Well done, Rebecca. Thank you for giving us that very correct answer. And then you've just gotten yourself a token of 2,000 naira. Well done and congratulations to you. All right. Congratulations to you. All of you that have been winning this money, you have not been publicizing this thing. You have not been publicizing. It's still the same set of people we have been seeing.
Yeah,
Gospel.
that's not fair at all.
It's not fair. It's not fair. It's not nice.
That's not nice of you at all.
Publicize it, publicize it, publicize it, guys. Publicize it for us. Okay. Yeah, yeah. Publicize it for us. Okay, guys. Publicize it. The answer is functioning, and that answer goes to Rebecca. I mean
Yeah,
that prize goes to Rebecca. Let's go to the number 19th question. And number
19.
20, we are going to take a pause and then we'll be back with the rest of the five questions. Okay, let's go to number 19.
All right, so it's during oxygen therapy, a patient suddenly becomes confused and restless. What should the nurse immediately assess? Time starts now.
So what are you doing? What are you doing? What are you doing? Don't forget, this is we are nurses and we are trying to test our knowledge on nursing care. And we're trying to, and nursing is very, 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 I don't know how best. It's one of those professions that it's one of those professions that you got to just be smart because at some point you're trying to you're working hard as much as the doctor. You're trying to do some of the things the doctor will do. You're trying to know what the physiotherapist would have done. You know a bit of what your OTs will do. You know a bit of what everybody does. Then coupled
Yeah,
with your own unique nursing roles, it can be that demanding. All right. Um, so what brought me to that? Anyway, just trying to fill the gap and pass the time. Thank you, guys. That's it. The answer is just reassess again the oxygen saturation. Reassess the oxygen saturation.
yeah,
In this case, the patient is what? The patient is what? Becoming confused. So, gospel. What I'm thinking is, in that case, you are already giving oxygen. Patient is becoming confused and restless. You want to see, is the oxygen really getting in? Do you need to probably just change the bag or whatever? you know, just see how well the person is even doing on oxygen. If the person is still desaturating, then you might need to escalate. But at least check to know, have a baseline before you now communicate with other members of the team. Over to you, Gospel. You're going to say something.
Yeah, I was going to say I've had a patient that normally he always comes in desaturated though, and then he's quite confused and all that stuff. Um, and then you find out that we place him or her rather on high flow oxygen, and
Mm,
then you find that the confusion sort of improves. And the next thing, maybe the person takes out the oxygen,
mm,
and then you see aggressiveness,
mm,
high state of confusion again, and all that. So basically, we just know that once that happens, the person is desaturating, probably
mm,
50%, sometimes 7 something percent, and then you just need to put back the oxygen for that person. So the best, it's just exactly the answer. Just always check the oxygen saturation of that
mm.
patient.
Yeah. And reminds me of part of the things we do when we're in school. Part of the part of the things they taught us then is when you are administering oxygen therapy, you always have your saturation, your what's it called, the probe,
Probe, yeah.
the stuff by the side. So you're always checking every 15 minutes or 30 minutes or so. So that
Yeah.
shows that. So because you need to have a baseline for whatever decision you're making going forward. All right, so that's it. And here we come. Before we go for a short break, we are going to have question 20.
Yeah, so a patient receiving high flow oxygen therapy reports a new onset of headaches and tingling in the fingers. What should be suspected? A patient receiving high flow therapy reports a new onset of headaches and tingling in the fingers. What should be suspected?
Honestly, I'm not sure we've spotted who got the last answer correctly.
Yeah, I
I'm not
think,
sure. So we are
yeah,
going to we did not. We did not. We are going to do that after now.
probably did not.
We did not.
No, we did. We
Did
did.
we?
Was it not the question on the
Oxygen. It's oxygen.
oxygen? Yeah.
Oxygen
So
saturation. We said they should check the oxygen saturation.
yeah. So oh, definitely it's not I know. It's Deborah. Yeah.
Yeah, the first person
The
here is
last
Deborah.
question was
Yeah,
Deborah.
the last
Deborah
person.
Ademo. She was
Yeah,
the one that
Adeyemo
got
Deborah. Thank Congratulations. Can you take notes? Deborah Adeyemo
it.
for number
Not
19. Question number.
Rebecca. Yeah. Sorry.
All right. Question number 19. Sorry about that. We're just engrossed in the talks.
Yeah.
Anyway, yeah. So that's that. Question number 20 done. And the answer is
Oxygen toxicity.
oxygen
Yeah.
toxicity. Oxygen toxicity. That's brilliant. A lot of people got it right. So let's see who gave us the most correct answer. Who gave it first?
I think the first person is Justina Ikundayo.
Brilliant. Justin Ayakunda, congratulations. Oxygen toxicity is the
Yeah.
correct answer, and you've just gotten yourself a token of 2,000 naira for giving us that answer. Well,
Just
for right,
think of the question again. Sorry.
okay, boss.
It says the patient receiving high blood oxygen therapy reported a new onset of headaches and tingling in the finger. Okay. So because I just saw what the nurse influencer posted.
Mm,
Answer was migraine. So
okay.
yeah, I just learned that recently as well. But
Mm,
now the thing is, if you have migraine, I don't know the scientific proof, but I was just speaking to colleagues, and I don't know what brought about that conversation, and they were like, if you have migraine, you can just sit for some minutes. I think is it 10 to 15 minutes on high flow oxygen. I think
mm,
10 minutes or so, either 10 minutes or 15 minutes. I'm not sure now.
mm,
On
mm,
high flow oxygen, and then after that 10 minutes, we even did it that day for a particular patient. We did that for the patient, and After that 10 minutes, we took off the oxygen. So there, I think there's probably a school of thought that says that helps with migraines as well. So
Okay.
just
Okay,
to
but
put,
yeah, and that even just further confirms that the answer is not migraine because
yeah, the answer is on
is
migraine.
receiving high flow oxygen. It should not be migraine in that case.
Yeah.
All right. So the answer is oxygen toxicity. Thank you for sharing that. I never knew that. You've added value to my life today for the first time in your life.
Shut up, shut up,
All right, guys. Well done, well done. Who got that right? I think we've given that the prize
Justina.
out. Justina, well done, Justina Ekunda. So you guys should stick with us in the next 5 minutes, 3 to 5 minutes. We'll be back. So if you are late, it's up to you. It's up to you. We are going to be back soon. All right. Thank you. Thank you. Hello, guys. Welcome back. Welcome back.
Oh.
Thank you guys for coming back. Okay, let's give them 1 minute to join back again. We still have, so we were supposed to do an hour and a half. So we've done an hour and 17 minutes. Um, so come back, guys. I've got 5 more questions, and you can still be the lucky winner of the remaining five. That's 10,000 naira if you can win 5 more questions.
Yep.
So don't go just now. Don't go yet. Don't go yet. All right. Well, um, here we go. We're going to question number 21, isn't it?
21.
All right.
Yeah.
Question number 21. This is it showing.
A patient on oxygen therapy reports difficulty sleeping due to dryness in the throat. What adjustment should be made to the therapy?
Your time starts now.
Yeah.
What adjustments would you make to that therapy, to the whole two therapy? The person is saying that becoming dry throat, dry throat, dry throat. What adjustment would you make? Yeah, thank you guys. Keep it coming, keep it coming. I'm glad you're still here with us. Thank you. Well done. Keep it coming, guys. Keep it coming. Keep it coming. What adjustment would you make in that case where you have patients reporting dryness? Well done, guys. Well done, Rebecca. I know. Well done, Rebecca. Everybody, well done, well done. Oh
Time
God,
up.
time up already. Sorry, guys. I've still looked it because I was still using the old setting for the other one. Anyways, that's us done. So, uh, well, I know you got it. So it's just to um, confirm the humidifier and see if it's not, and then just add some water and humidity, basically. So somebody got it. Humidity is the answer. Who's got it? I think I know answered it.
Yeah, let's just give it to her. But she
I know
said
how the
water.
humidifier is. I mean the humidifier, yeah. So she gave it us. So Rebecca, I know congratulations once again. You've just got yourself a token of 22,000 naira. I was going to say 20,000 naira. We'll soon get there. We'll soon get there. Anyway, I'm going to announce. I'm going to announce another something. If you are interested, just wait. But we are going to pick from those of you who have always been participating.
Sorry.
I actually read from 3 minutes before the big time.
Oh, I'm just getting the. Can you lower the volume? I'm just getting gospel. Let's check again. I'm just getting a comment there. Oh God, gospel.
Yeah.
Are you, Kenny is saying that I would just. What am I saying? That someone else's own came before Rebecca.
No.
So the first person that spoke said they gave a response said reduce oxygen supply. And Woju said humidify it. Then
No. How
sorry,
would you say
Rebecca said
water for the
water
oxygen?
for the oxygen,
Yeah.
and Woju said humidify it. Hmm. 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 I don't know what to say. Trapped, trapped by your own rules. Oh, Elizabeth and Rebecca, I not said amen. Yes, we'll get there. We'll get there by God's grace. But
Mhm.
I honestly think because the answer already carries humidity, humidify, whatever, anything related to that.
Yeah.
And first person to give us that was Anwojoluwa to missing, and that's the positive. I'm sorry. I'm
Yeah.
sorry. Whoever I called the first time, I'm sorry about that. Right? we say the rule is the most correct answer. The first person to give us the most correct answer. Okay, guys, we still have four more questions to go, so please permit us to run. Please permit us to run. Okay, so we can give out the entire 50,000 naira for today. 22, number 22 now. Showing.
The nurse is providing discharge teaching to a patient who has completed TB treatment. The patient asks what follow-up is needed. What type of follow-up test will monitor for reoccurrence? Time starts now.
So basically, how do you monitor? How do you diagnose? How do you monitor the reoccurrence of TB? What test do you do to see that, to confirm that somebody's got tuberculosis? Remember, we are dealing with respiratory illnesses, so we have now moved on to another. Oh God! Well done, guys. Well done, guys. For doing well today. Doing very well today. Isn't it gospel?
Yeah.
Oh, it's been a busy day. So yeah,
Busy, busy.
busy. Ah, I'm so proud of you guys, and I think I want to create a community with you guys. Honestly, you guys you're making me proud. Like, you're studying really hard, man. So, but the answer for this question is chest X-ray. So
Yep.
honestly, you do sputum AFB, you do all of that, but the most definitive way to confirm CB is to do a chest
Mhm.
X-ray. So I'm not sure anybody got that right. Did I say
No.
chest X-ray? No. A lot of people suggested sputum culture, gene expert, all of that.
Someone said chest X-ray. And would you?
Oh, and would you said chest X-ray? Congratulations, and
Yeah.
would you? Yes. Kenny also flagged me just now. And would you, Oluwatomisi, congratulations for getting that correctly. So you can, if you have been around medics when they do this very well, you know what. So all you just need to do in your own case is to inform the patient. So we'll be coming in later on for a chest X-ray to, you know, just to communicate with the patient. Oh, oh my God! Is somebody contesting this? Anyway, I don't want to read the comments. I don't want us to go beyond time. So we've got 5 more minutes to go. Number 23, guys. Number 23. Let's go. We'll sort out every issue later on. Okay.
A patient with active TB is non-compliant with their medication regime. The nurse educates the patient about the risk of developing a more severe form of TB. What is this severe form called?
So you're trying to speak to a patient about, they are not compliant. You're trying to explain to them the danger of non-compliance. So you're trying to tell them what that will be. What terminology do you use to describe the event that happens when the patient is not compliant, and then um, that very thing that happens. I'm careful not to say it. Yes, guys. Yes, guys. Keep it coming, guys. Keep it coming. 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 There's a terminology we use that explains how you would communicate it correctly and carefully to the patient. Okay, so keep your answers coming, guys. Keep your answers coming, and that's us sorted that
Yep.
question. So the answer to that is multi-drug resistant.
NDR.
Yeah, I think we should
Hmm.
have somebody get that correctly. It's a simple question, isn't it?
I think it was Justina. Justina got it right.
Yeah, Justina. Justina. Congratulations, Justina. I'm struggling to find that Justina on my page on my place here. Justina. What's the surname again? Or the other name?
Wait, but that answer is coming upward. I don't understand how this is working. It's coming before the question was asked. Do you get what I mean? So she's not the one that got
Oh yeah. No. Hey, you see what I'm saying? Because I was wondering where is this. So she probably took MDRTB
yeah,
for the
the
answer,
other
as the
question.
answer to the previous question. So and that's
Uh,
not this question came in after Rebecca, said that came in after your answer was displayed.
yeah,
DR, the nurse influencer was how would you said DR, which is drug resistance. Um, nurse influencer said active tuberculosis. How would you say drug resistance? Rebecca said atelectasis. Elizabeth said TB meningitis. DR again, resistant TB, military. Or is that military? I don't know what that is. Deborah Adeyemo says MDTR-TB. So,
it's Deborah that got it.
yeah, yeah. So, Deborah got it. She gave us the most correct answer. It's called multi-drug resistance TB. Thank you, guys. Thank you. I can see the contemplations in the comment section. Thank you. Figured that out already. All right. Thank you, guys. Multi-drug resistance TB, and that prize goes to Deborah Adeyemo. Well done, Deborah Adeyemo. Let's go on to the penultimate question, number 24.
A patient on TB treatment reports orange coloration of urine and tears. What is what
Is the
particular medicine
sorry,
is
that
the
was
cause of this
what particular
discoloration?
medicine is the cause of this discoloration? Sorry for that. Sorry about that. Whatever. Let me
Ah,
see if I can
don't
find it.
get that worried. Don't get that worried. Don't get that worried. You don't dey get am already.
Well, That's good, guys. That's good, guys. Keep it coming. Keep it coming. You people are so brilliant. My God, I would have thought that somebody is having a high brain here, gospel, because somebody is just giving the answer like pam. That's good. That's good. Well done, guys. Take care, pal. Well done, guys. You're doing well. You're doing well. Oh, we did not meet up with time today. But yeah, we're almost there. We're almost there. And that's us done with
Yeah.
that question. And the answer is what many of you guessed correctly. The answer is rifampicin.
Vaccine. And would you
Right? You're right. Yeah. So well done, guys. Rifampicin is the correct answer. And the very first person to drop the answer, I think, got it correctly. That what's her name again? Anwoju Oluwatomisin. Well done, Anwoju. Congratulations. You've got yourself a token. A token. Let's go to the final question for today. Final question for today. Final question. Final question. Showing number 25 now.
a patient with a history of latent TB presents with a new onset of cough, night sweats, and weight loss. Sputum smear comes back positive for acid fast bacilli. What condition has most likely developed?
So the patient used to have a latent TB. Now there is onset of cough, night sweat, weight loss. Apparently the symptoms are worsening. So positive, positive um acid fast bacilli, AFB, sputum AFB in this case. So what condition must have developed? Good, good. Keep it coming, guys. I can see your answers, and I'm really proud of you guys. I'm really proud of you guys. I'm really proud of you. Okay, gospel. That's us done.
Yeah.
That's us done.
Sorry.
Please check the answer. I think the answer is active TB. Who got it right?
Be, be baker.
So the person was having latent before, guys. Now is now so the symptoms have now worsened. So obviously it's now active. Okay. Thank you, gospel, for highlighting that active TB, Rebecca. Well done, guys. Well done. So that's us. That's us. Oh, Kenny, do you know who got the most correct? I mean, most answers today. Who is going on with the highest money today? Somebody should be going up to 10,000 naira. I mean, somebody should be having like,
Ooh.
oh God, how much is she getting? Oh, brilliant. Somebody's going on with 14,000 naira. Somebody's going on with
Wow.
naira. Correct. That's good. Seven correct questions. Well done. And then some people will be going on with 10,000, I believe. Some others, and that's good. That's good. So this is what I wanted to discuss with us before we all go. So don't leave yet. Don't leave just yet. Please, if you have not subscribed, please subscribe. If you have not liked, please like. Okay. I'm just thinking, gospel, that we could bring, say, any of them who is free for the next edition, so we could curate a fresh edition where we would have them join us on the studio, and we just have it like ask them questions directly. You know what I mean? So I think I
Yeah.
discussed it with you.
Yeah, you did.
So if you guys like the idea of joining us live on stage, but the only concern I'm having is internet connection. If you live where gospel lives in the downtown.
Ah, shading.
Ah,
I
anyway,
see.
I'm just thinking if you want to join us on the studio and we have it live,
You must be living in Lekki.
so you just be sure that we're not going to pardon you because your network is bad, unfortunately, because it's some of these questions are pretty much time bound. So if you if you have too much time to think about it, you're likely going to get the answer right, and that will defeat the
Yeah.
purpose of the quiz. So um so we're thinking about that, and we're also thinking of it in the direction of, if we could have the two of you again in this time join us, and then you compete against each other, so we can have, say for example, Rebecca, I know, and
Deborah.
Deborah Adeyemo, or Anwoju, or the Star
Yeah. The
Queen,
nurse
or
influencer.
the Nurse Influencer. All of these are our wonderful participants who've been coming every week. I mean, every month. You can join us on stage. Definitely, the price for that one will be higher.
Yeah,
Price for that
definitely.
one is higher, because that one you are putting a lot of. You are going to prepare. We are going to give you clear cut instructions on where to study, what to study. We are not just going to give you random questions. All right. So we're going to give you clear cut instruction on what to study, where to study. If you think that's a good idea, put it in the comment section. Yes, you want it. And describe the one you want. Describe the one you want. Describe which one you are willing to participate in. Okay, let's know if it's something we want to go for. We're just doing a sampling of opinions right now, and you're the best set of people we need to ask, because you've been with us from the very first time we started this up until this moment. Thank you guys. Thank you guys. Thank you guys. So let us know what you think about the idea. Let us know what you think about this idea. Let us know what you think about this idea. Brilliant, brilliant. I'm seeing some comments already. Well done, well done, well done, well done. Yeah, how would you want it? How would you want it? So let's see one more person who wants to join, and would you? Let's see one more person who wants to join, and would you? Oh,
Let's
let's do
do this.
this. Nothing Finsa. Let's do this. Good, 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 good. Let's
Who
do this.
wants to be a millionaire?
Who wants to be a millionaire? Okay, that well, this time around, who wants to be a you said don't become millionaire. You said don't become millionaire.
Oh my
Anyway,
God. Small, small, small,
uh,
small.
now small small. Who said we go? But you could be. Gospel is a millionaire in naira. Oh, you know what I mean?
Excuse you.
He's just hiding under one finger. Oh.
Excuse you, pal. We're still in this is it who's our president again? Sef? That's how much we've just lost touch with Nigeria and what's happening in
Yeah,
Nigeria. Just we are just walking, 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 walking. Trying
yeah,
to
yeah, yeah. So that's it.
all
That's it.
right.
Not really because we have so much money somewhere, eating somewhere. But just like you
Yeah,
said, we're just doing something to give back to the community that raised us, that gave us the opportunity that we have today. And yeah, so Kenny just reminded me to say that we sh- the idea was that while we have people on stage who will be answering questions and be competing head to head, we would
yeah,
also have participants join us this way. Rebecca said, "Well, I bet too." Ah, oh God. Yeah, so Kenny is just advising that we also have a few like questions that will still go this pattern we have been doing it. So
yeah,
in the course of the quiz, we would have questions thrown to the audience
yeah,
in the
definitely.
comment section. So I think it's a good idea, something to try, something to try, something to
Yeah, we
try.
can give it a bash.
Yeah,
We just
give it a
like
bash.
yeah. So
And we'll see how it goes. We'll see how it goes.
and there it goes.
We'll see how it goes. So maybe we'll
Yeah,
try that for so for since we have two people who showed interest first.
yeah.
Who are those two people again?
And Woju Oluwa
Oluwatomi
Tomisin. Yeah, I was
and the
just
nurse
and the
influencer.
nurse
And the nurse
influencer.
influencer. Yes. So for September, by God's grace, we'll let you know the date and the time. We'll definitely put it up. So let me just put that up quickly. The announcement. So if you have not joined this channel, please join bit.ly/nosd. It's very easy for you to. So you just join the channel. You can easily find um everything we are doing, all of the activities we're doing as a small group, But they say we should not say we are small, we are big. And then if you have won anything for today, don't
That's the
forget
number.
to call or just message this number
No,
on WhatsApp. On
please
WhatsApp. Any of
message
your
only. Please
message only,
message
please.
only.
Message only,
Thank you.
please. Message only, please. And this is Nigeria's number anyway, because we now know some people are joining us from the United Kingdom. We are so popular as far.
Ah, yeah, I didn't know.
So if I join us from the United Kingdom, guys, we're not having multinational influence.
Oh wow, that's good.
That's good. That's good.
We are reaching the ends of the earth.
Ends of the earth, you know what I mean? Yeah. So well done, guys. Well done. So please contact that number if you got any question currently, and please make sure to follow us on our channel. You get information about the all of what we just discussed about now. So I think it's how would you and the nurse influencer. How would you nurse influencer? We hope to see you compete head on.
Head to
And
head.
so, one thing we are setting as part of the rules is that you need to get people to join us. So, you will bring a
Yeah,
lot of supporters club. So,
yeah.
that's your task, that's your assignment. You publicize this, and let people join us. Let them come and see you compete to win a prize. And let me let you know this time around, it is not just 50,000 naira, especially for the two people that will be competing.
Hmm.
Like, it's not 50,000 naira. Well, gospel, we've not concluded how much we will give you.
Yeah, we need to consult the gods
We
about
consult
that.
the gods. Yeah, we consult the gods. So we know how much you get for each correct question. We know
Yeah,
how much you get for each correct question. How would you and nurse influencer? Let me know if you are still students. Let me know if you are still students. Which school are
yeah. I
you?
think they are still both students. I think
So that
so.
will be fair enough. We'll not be bringing CNO against
Against the DNS.
ADDNS against
ADDNS against year two students.
I tell you, now we just come and come and finish everything.
Oh my gosh.
We're almost done. We're
And
almost
then
done.
so that you will not embarrass the DNS. just in case.
Mm,
Yeah. You don't want, you don't want that. You
we don't want our DDNS to be
don't want to
embarrassed.
embarrass a GDNS. You don't have. You don't have.
Oh
Oh,
God.
just
Okay.
graduated. Nursing plenty has just graduated. And Woju is still a student of Sacred Heart College of Nursing.
Okay.
Right?
Okay. 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 I think it's a fair competition, to be honest.
Is it?
It is. It is. I. So so how would you
Oh
say
yeah, they
final
are
year
both
students?
final
Yeah.
year students. All right, it's
So
fair. Fair enough.
technically, yeah.
It's fair enough.
So we are going for that next month. So we'd let you know about the modalities, right? On
Yeah.
the channel. So join the channel, invite your friends to join the channel. Invite your friends to join the channel. Just type on your browser www.bit.ly/nosd and you will get yourself on the channel right about the moment you do that. But don't forget to like this stream, to share this stream as well. As much as it's a live competition we are doing now, it's also something you can learn from. You can always come back to watch and get the questions, research further, and just to get yourself um, better informed about cases or things that relates to care of patients with respiratory illnesses. All right. I think it's a good time to start to wind down. Okay. If you've got any questions, let us know in the comment section. Gospel, over to you if you have anything, your final words.
Yeah. On the final note, I just want to thank everyone that took our time to join us this evening for the first time. As a big thank you. I think I can recognize some names um, that joined us for the first time. Justina Ekundayo, I think she joined us for the first time, if I'm not
Mm-hmm.
mistaken. And I think Deborah Adiemo also joined us for the first time.
Mm-hmm.
Yeah, so I'm not really sure, Star Queen. I don't think that's your first time, but anyways, the Star Queen, if this is your first time as well, uh,
Now, our
we're
Star Queen has
really,
been here, Gospel. Star Queen.
yeah,
Star
that's
Queen
what I'm
has taken
saying.
our money now.
That's what I'm saying. And then I saw someone, Ezra Ajayi.
Aye,
Yeah,
aye.
Ezra
I'm not sure.
Ajayi.
It
So
appears she
I
is
don't think,
new. I don't know if it's he or she anyway.
yeah. So, but
Welcome,
anyways,
guys.
thank you very much for joining us and welcome. It's going to happen sometime in September again, and then we're looking forward to having um
Head
the
to head
first
challenge.
episode, or yeah, of the head-to-head challenge, and we look forward to seeing you guys next month. Same station,
Same channel.
same
same,
time,
same time, but not same date.
same time next month.
We're not
So
sure anyway. So,
that's me signing out from my end.
all right. Thank you guys once again. Again, remember that this platform is entirely just to help you develop yourself educationally, and we are only doing this to support your learning process, especially for those who are in school or those who are freshly graduated from school.
Mhm.
That's really our target, but we are open to other people. However, when we spot you, we'll milk you. You are going to start donating to others because we will get you to donate. However,
Yeah,
so the goal of this is just to support your learning process. We understand that a lot of times learning can be difficult, but we're creating a fun-filled environment for you to learn as well. Okay, and
yeah,
then at least get something as a reward for learning.
learning. Yeah,
Right. So that's the whole idea
nice.
of this. And then we hope that you've gotten a lot of value. If you have gotten a lot of value, you've learned something from here today, put it in the comment section. If you have been learning, put it on your social media page, put it on your Twitter, put it on your Instagram, put it on your WhatsApp status. Let somebody know on LinkedIn that you've been learning and getting great value from this platform and you wish to have them also join us. All right. Well done, guys. Well done, everybody. So it's about time to get out of here and let's face other businesses of the day.
Yeah,
All right. Thank you, everybody. Thank you, everybody. We'll be signing out in the next few seconds, and you'll be seeing some adverts showing. Don't forget to follow this channel. Don't forget to, if you got any, if you got any question correctly, please chat this number. Many of you already know this number. If you don't know this number already, just copy it right now and charter immediately. If you don't charter by midnight today, your money is just anyway. That's us done. Goodbye, guys. Goodbye, 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 goodbye.